Hi.
Hi.
So you must be Michelle.
Yes.
So what brings you in today? You're just here for a wellness visit?
Yes.
Perfect. Okay. So just to start the visit, I'd just like to get a little bit of information about your health history. So I'm just going to be asking you some questions and just try to answer as honestly as you can. If you don't know, that's okay. But we'll just go from there, just so I can kind of get a background of what's going on with your whole picture.
Okay.
Okay, cool. So tell me how old you are.
26.
Okay. I'm just going to be typing a couple notes here.
Okay.
And do you have any current health concerns or symptoms of anything that you'd like me to address today?
Not really. I just got diagnosed with psoriasis from my dermatologist, but that's really it.
Okay. All right. I'm going to note that. And then when was your last visit to the doctor?
The dermatologist was like a week ago.
Okay.
And then other than that, I mean, I see my doctor annually.
Okay. Perfect. So that's what you're in here for today, is just your annual visit.
Right.
So it's been about a year then?
Yeah.
Okay, cool. All right. So other than psoriasis, have you been diagnosed with anything else?
I have a diagnosis for ADHD.
Okay. And do you take any medicines for the psoriasis?
No, I just have a steroid that I put in my hair and stuff.
Okay, so it's a topical cream.
Yeah.
Okay. And then do you take any medicines for the ADHD?
Yeah, I take Adderall twice a day. It's a 10 milligram. And then I take Wellbutrin once a day.
Okay, and do you know the milligrams of that one?
I believe it's 150.
Okay. How long have you been taking those?
Since I started law school, so like 3 years.
Okay. So you're in law school. Tell me more about that.
Well, I actually just graduated in May, so I'm
Congratulations.
Thank you. Yeah.
So what's your degree? Does that make you a Juris Doctorate?
Yes.
Awesome. Congratulations.
Thank you.
So highest level of education is a doctorate then?
Yes.
Okay. Just going back to your past medical really quick, I wanted to ask if you drink caffeine or use any other type of substances like nicotine, alcohol.
I drink socially, rarely,
Okay.
like once, maybe twice a week.
Okay.
And then I take like pre-workout.
Okay.
And coffee, so caffeine, yeah.
Eat
nicotine.
Once a day for the caffeine, or I'm sorry, like one coffee a day, and you use the pre-workout every day, or about
Pre-workout every day. I haven't been drinking coffee as much.
Okay.
And then no nicotine, alcohol, like.
Yeah, socially you said. So
yeah.
You said once or twice a week.
Yeah.
Okay. And then do you know if your immunizations are up to date from childhood?
Yeah.
So like your Tdap, MMR.
Yeah, I have.
Yeah.
My mom makes sure I get everything I need.
Okay.
I don't know what they all are, but.
That's okay. What about flu and COVID? Did you get your vaccines for those this year?
Did not get flu. Do have COVID.
Okay. Just gonna back that out. Okay. And then have you been hospitalized ever? Never in your life? Ever had surgery?
No, when I was younger, I think I went to the hospital for like an anxiety thing, but other than that.
Just to you went to the ED though. You weren't admitted as a patient?
No.
Okay. Okay. Now I'm going to ask you a couple things about your family. So tell me, how's your living situation? Do you live at home still?
Yeah, I live at home with my mom and my dad and my brother.
Okay. And how old is your mom?
My mom's 62 and my dad's also 62.
Okay. Any medical history that you know of?
I think my mom has high blood pressure and my dad has high cholesterol.
Okay. Yep. You might have also heard it called hyperlipidemia.
Maybe, I don't know. I just know he says he has high cholesterol.
He does?
Yeah.
Okay. And then your parents you said you live at home with your parents and your brother.
Mm-hmm.
Okay. And then how's your brother?
He's 28.
Any medical history that we know of
No.
for him? No?
Nope.
Pretty healthy?
Yeah, he doesn't have anything.
Great.
Me, my mom, and my brother.
Okay.
Or me, my mom, and my dad, I should say.
Oh.
Brother has no
No diagnoses?
No.
Okay. And then do you know about your mother's parents.
I know that my mom's father has passed away.
Do you know how he died?
He fell and then he went to the hospital and I believe he was septic and he just...
I'm so sorry to hear that.
That's okay. It was better that way.
Okay, and then grandmother?
She was in the hospital. They had a tube. Then she came back home, and then she went to the hospital and died in her sleep.
Okay.
I don't know. She had a lot of issues. She had like an autoimmune. It was like some something.
Hashimoto's, maybe?
Yeah.
Does that sound familiar?
I know it's something.
Okay.
But it's an autoimmune.
Okay.
Because when I went to the dermatologist, they asked me about if anyone in my family had autoimmune, and my grandma's the only one I know.
Okay. And then, so you said you live there. I want to put that your highest level of education is a doctorate. And then are you working with a law firm or anything yet?
Yeah, I work for Kelso Law Group.
Okay.
And I'm just working as a law clerk right now. And I work like full time there.
Okay. And then, would you say you have a strong support system?
Yeah, absolutely.
Okay. Any religious preferences?
I mean, we're Lutheran, but...
Okay. You don't really... Do you follow it?
I'm confirmed, but I don't really
go
to church or anything.
And then, what do you do how do you like to spend your free time? Do you have things you do to relieve stress, or, when you're not working, what do you like to do?
I work out, and I like hang out with my parents. My brother and I are really close, and then my friends.
Okay. Are you doing cardio exercises and weight exercises?
So I do Monday, Wednesday, Friday. Actually, I do, that's my leg day, and then Tuesdays, Thursdays are upper body. So Monday through Friday, I'm doing weight training, and then...
How often do you do cardio?
Oh, just on Saturday and Sunday.
Okay.
So twice a week.
Wow, you stay active.
Very active.
And then, how would you describe your diet?
I feel like it's pretty good, yeah.
You said you don't have any allergies. Do you have any dietary restrictions?
Technically, no, but I've cut out gluten, soy, dairy, just because of I don't know, when I...
To help with the skin?
Yeah.
How long have you been following that?
It's fairly new, like within the last week, ever since the diagnosis.
Okay. Okay. Now I'm just going to go over what we call a review of systems. So it's kind of like the physical exam, but just kind of the subjective portion of it. So just us kind of talking through it before I actually listen to you and actually do the exam.
Okay.
So just a bunch of questions kind of to formulate the rest of your medical history.
Okay.
Okay. So any fevers, chills, malaise, fatigue? This is going to be a lot of yes and no for you.
No.
Okay. Do you wear contacts or glasses?
I do not.
No? Have you ever been to the eye doctor?
No.
No?
I don't think so. No.
Have you ever had any vision trouble or?
No.
No? Okay. What about any problems with your hearing, with your nose?
Nope.
Any nasal drainage?
Nope.
Headaches? Any throat pain, ringing in the ears?
Nope.
Any sensitivity to light?
Nope.
Have you ever fainted?
Nope.
Okay. Ever had any enlarged lymph nodes or anything like that?
Nope.
No swelling in your extremities?
Nope.
Okay. How about cough?
No.
Shortness of breath? Any wheezing? Any history of asthma?
Nope.
Do you ever get any chest tightness or find it hard to breathe?
Nope.
Increased work of breathing? Your breathing is relative when you're doing your workouts. You're breathing appropriately.
Yeah.
Any history of COPD or what we call obstructive sleep apnea? Stop breathing in your sleep.
No.
Never been told you do that.
Nope.
Okay. Any chest pain or palpitations?
Nope.
Ever had any feeling like your heart's racing or anything like that? Okay, and you said you've never had leg swelling. Any history of heart attack? Ever had anything like that happen to you?
No.
Okay, good. Never had been told that you have a dysrhythmia
No.
on an EKG? Good. Okay, any belly pain?
No.
Any bloating or tenderness?
Nope.
Constipation, diarrhea, having normal bowel movements?
Yep.
Okay. Any nausea, vomiting?
Nope.
Any heartburn?
Nope.
Okay. How's your appetite? You're eating okay?
Yep.
Okay. Any history of gallstones? Any history of hemorrhoids?
Nope.
Ulcers? I assume you're a bit young. I doubt you've had a colonoscopy or anything like that, but no known history of it in your family. Okay. How about when you pee? Everything's okay there? No burning, itching, sensitivity?
Nope.
No urgency, frequency? No wetting the bed?
Nope.
Okay. No incontinence, like, you accidentally pee your pants a little, or that's what we call stress incontinence. Nothing like that. Any
Nope.
history of kidney stones?
Nope.
Okay. You mentioned Hashimoto's in your family history. Have you ever had any history of thyroid problems for yourself? Hypo or hyperthyroid?
Nope.
Any recent change in your weight that was unplanned, like a loss or a gain of a significant amount?
Nope.
Okay. No history of diabetes either?
Nope.
Okay, very good. And you told me that you did just get recently diagnosed with psoriasis. You said that was a week or so ago.
Yeah.
Okay. Do you have any present areas of concern that you wanted me to look at today? You feel that that's being well treated by the specialist you're seeing?
Yeah.
Okay.
I mean, they've all pretty much gone away for the most part.
With that topical
Yeah.
steroid? Great. And have you ever had any areas of concern, like moles or freckles that have changed, or they look different in nature?
No.
Or new ones appearing?
No.
Okay. Any concerns for your breast? Any secretions?
No.
You're not. Have you ever been pregnant?
No.
Okay, so no lactation.
No.
Are you doing your yearly self skin checks?
Yeah.
To make sure no new moles and things like that?
Yep.
Okay. Any history of broken bones or
No.
muscle weakness? Any injury to your body at all now, or history of?
No.
Okay. Any history of STIs or STDs?
No.
No? Okay. And are you sexually active?
Yep.
Okay. And do you use contraceptive?
Yeah.
What do you use?
Condoms.
Okay.
I'm
And
not on birth control, so.
okay. And sex is okay? No difficulty with climaxing?
Right.
Healthy sexual lifestyle? Perfect. Okay. Ever had any lightheadedness, dizziness?
Nope.
Any numbness or tingling to the extremities?
Nope.
Have you ever had any difficulty with your memory?
Nope.
Ever have a history of seizures or tremors or paralysis, partial or anything like that? Okay. And then, have you ever had any abnormal bruising?
Nope.
Have you ever been told that you have any type of bleeding disorder or abnormal bleeding,
No.
trouble with clots? No. Any history of anemia or blood loss?
Nope.
Never had a blood transfusion?
Nope.
Okay. And then, never had a blood clot?
Nope.
Very good. And then last area here, I just want to ask about, you said that you have a pretty good strong support system in your
Right.
family. Sorry, my assistant. I'll be right with you, Jackie. So do you find that your family is your strong system of support for coping?
Yes.
Okay. And do you ever have any feelings of anxiety or depression?
Not really.
Ever had any suicidal thoughts or
No.
thoughts of wanting to hurt yourself?
Nope.
Good. Any difficulty with sleeping or trouble with your sleep pattern?
Nope.
Can't fall asleep or sleeping too much?
Nope.
Okay. Trouble staying asleep?
Nope.
Okay. All right. Well, then that concludes the kind of subjective portion. Like I said, this interview style part of the exam. So if you have anything else you want to tell me about your history, anything I missed?
Nope.
Okay. Then we'll go ahead and move forward now to the physical exam.
Okay.